Hi, I'm Dr. Bonds. I'm a primary care physician at Evergreen Family Medicine. Here we use a system called Phreesia to allow you to give us feedback about our practice. Overwhelmingly, the responses that we get are positive, but occasionally we do get some negative comments and some constructive criticism. I'd like to take a second just to respond to some of the questions and concerns that we get on Phreesia. So one of the common things that we get in the negative feedback section is that our wait times are too long, or that you're expected to show up on time, but the doctor is sometimes 20, 30 minutes behind. And I want to let you know that I completely agree. Sometimes you do wait a long time, and your time is valuable just like I believe my time is valuable. Unfortunately, in family medicine, we are very broad in our practice and what we take care of. On a daily basis, I can take care of something as simple as toenail fungus all the way up to terminal cancer. And so oftentimes when you're waiting a long time, it's because the patient before you has something going on that I need to spend extra time to take care of. And while that does mean that you may have to wait to see your provider, when it comes time for you to need the extra attention that we're giving the patient before you, you'll get that same attention. But we do appreciate your patience, and just know that we are doing our best to try to stay on time as much as we can. One other response that we get at Evergreen is that patients sometimes feel that their provider didn't give them what they came to the visit for, either a medication or a referral or some other therapy. While this may be true, it's for a reason. When you come to us for our medical opinion on what's needed to fix the problem that you're having. And we may not always agree with the thing that you found on the internet, or that your friend told you, or that you feel like has worked for you in the past. And we hope that as your physicians and primary care providers, that you trust us enough to allow us to use the training that we've amassed to treat you in the best way we know possible. Our only goal is to provide you quality care and to first do no harm. And sometimes we may not be correct, and you may need the thing that you think that you need. And if that happens, then we're happy to reassess and to see you again and to try to make another attempt to fix the problem that you're having. But we do appreciate the trust that you have in us to provide the care in the first place. I do recommend for you to maintain an open line of communication with your provider. We have a patient portal that works excellent for that. And if what we're doing for you is not working, then we want to know it, and we want to fix it, and we want to make it better. Patients sometimes also will tell us that they are upset that they aren't able to always see their assigned physician. And this is true. We're a large practice, and we're very busy. We see a lot of patients. But we work in a team setting with the PAs and the nurse practitioners all together to provide the care that you need. And if I'm not available to be seen, then one of the PAs or the nurse practitioners would gladly see you. And if they're not available, I would gladly see you in their place. Occasionally we get feedback from patients that their provider did not address all of their concerns at the visit. I do recommend that patients come in with a list of all their concerns, so that way we at least can know the concerns that they have. But I do implore you to be reasonable with what your expectations are during a visit. If a problem that you're having has been going on for years, it often takes more than one 20-minute visit to take care of. If we're trying to take care of 10 or 15 different problems, we'll probably get things wrong, and we won't be able to dive in and really figure out what's going on. So if you prioritize your problems, even if you have 10 of them, and say, the first 3 are the most important, let's work on those, but I have these other 7 problems that I really would like to be addressed. We can schedule you for another visit to come and just talk about those things, and then maybe follow up on the first 3 things about whether what we did worked. I think that's the better way to manage your care, and that just needs to have open communication between you and the provider. And that leads us into one of the next responses that we get from patients, is that they may sometimes feel unheard, or that no one is listening to them. I really hate to hear that. And as a physician, my job is to try to listen to you and to figure out what's going on. We need you. We need your responses, because there's only so much I can get from a physical exam or labs. I need your story. I need to know what's going on with you. Sometimes we may fall short with that, and we may try to move the conversation along if we think it's non-productive, or try to get to something that we feel is important to try to make a decision. And if that leaves you feeling unheard, or that no one is listening, I encourage you to talk with your provider about that and to let them know that that's the way that you feel and to see if there's a way that we can improve upon it. Because we all want to improve and we all want to do the best for you that we can. Ultimately, some people are just not happy with the provider that they have for whatever reason. And that's okay. A doctor-patient relationship is not a marriage of till death do you part. There are other providers in our clinic, and we could gladly switch you. We never try to encourage that because often the grass is not greener on the other side. But if you would like to switch providers, there's a form that you fill out that's reviewed by our staff, and we generally try to accommodate you to find the best fit for you at Evergreen. So I hope that that helped answer some of the questions or concerns that people have left us on Freesia. Freesia is a great way to leave your feedback and to let us know how we're doing. At Evergreen, we want to do better, and we want to provide you quality care. So thank you for leaving your feedback, and thank you for being a patient at Evergreen Family Medicine.